President William Ruto has ruled out a salary review for the striking doctors, saying the country's wage bill is already bloated.
The president, however, said the 1,500 intern doctors will be hired at 70,000 shillings stipend as offered by the government and asked them to take it or leave it. The deadlock is likely to plunge the country's health sector into a deeper crisis, as the doctors' union told the president not to use the wage bill excuse to wiggle out of meeting their demands. Brenda Wanga reports.
Everything that is used in this country, Lord.
Hours after jetting back into the country and straight into the burning issue that has seen health services in public health facilities paralyzed across the country, the ongoing doctor strike now nearing the 1-month mark. The president broke his silence on the weighty matter in an emphatic manner.
I'm telling our friends, the doctors, that we mind about them, we value the service they give to our nation, but we must live within our means. The resources we have are only sufficient to pay 70,000 shillings for intern doctors. It is not a salary, it is a stipend for only 1 year, and then they will be employed. And we want all our doctors, all our doctor interns to be taken in.
The president says the doctors' demands that the government honours the 2017 CBA would mean burdening the taxpayer who is already dealing with a bloated wage bill. Ruto says the country's wage bill is already way above the constitutionally allowed limit of 35%, noting that this is not sustainable.
We are spending 1.1 trillion shillings every year to pay salaries and wages of the 2.2 trillion we collect. It is way above what we should be spending. We are spending 47%. Our wage bill is 47% of our revenues. It should be 35% according to the law. So we are way above.
But the doctors who downed their tools last month say the government cannot hide behind the wage bill to deny them their rights. The KMPDU leadership says the government itself agreed to the terms of the CBA that saw intern doctors granted stipends of nearly 200,000 shillings.
So we want to put it out very clearly that we have not yet asked for salary increase for medical interns or for doctors, but it is contained in our new CBA, which has not been negotiated. Therefore, this is what has been paid for the last 7 years. It is just a shock to us that then it's being reduced in 2024. It's a concern. By a third, actually, in 2024.
Doctors also disputing the president's assertion that agreeing to the doctors' demand would add to the country's wage bill exponentially. They maintain if the question of the wage bill is to be addressed, it should cut across all sectors of the public service, including salaries of state officers.
We must live within our means. And we are going to have a bigger conversation as Kenyans, so that when the Bible says that a responsible father leaves an inheritance for their children, we as Kenyans, we should not leave debt to our children. We should leave an inheritance.
But the same Bible in the book of Matthew chapter 7 states clearly that which father will give his children snakes when they ask for fish? Or which one will give his children stone when they ask for bread? And therefore, we are asking for bread that we have been eating for the last 7 years.
The doctors say their strike now on its 25th day will go on until their demands are met, but say they are ready and willing to sit down on the negotiating table. But this time, they insist the government must show goodwill.
Any engagement, we don't hope that the government team will walk out the way they did last time, because they have shown utterly that they don't care whether Kenyans are suffering.
The doctors are, in the meantime, planning for what they say will be a mega protest this Tuesday to further buttress their demands that the CBA be fully implemented. Brenda Wanga, Citizen TV.